Olebogeng is covering for us the expo and in relation to the health, of course, and the social department in that Bophirima province. Let's say hi once more to her.
Welcome back, Palisa, to the Maputo Convention Center. We are at the Health and Social Development Expo. We just received a visitor, a very important visitor, because she is the co-host of this event in partnership with the Department of Health. I'm talking about Memam Simutobi. She's the HOD for the Department of Social Development, and we're glad to have you here. Good morning, Memam Si. Just briefly tell us about your role in the partnership with the Department of Health.
Good morning, South Africa. We are the Department of Social Development Northwest. We are in this show together with Health because our core mandate as the two departments is to make sure that we have a citizen that is healthy, that is well-rounded, that is functioning in the family, in the community, and in all the structures. What we hope to get out of this show is to strengthen our partnership, because everybody knows that government cannot do it alone. The allocations that we all get can only go so far. But there is a lot that we can jointly do with the private sector, with the universities, with the non-profit organizations, with everybody who is interested in the well-being of the citizen.
And briefly tell me about your objective as social development in this expo.
Well, we serve humanity from the cradle to the grave, together with health. When a child is born, health is there, the birth certificate, and so on and so on. But we have to ensure that child has early childhood development, that child goes to school, that child belongs to a family that is well-rounded and functional. The young people, you all know the social ills that make young people vulnerable. Drugs, crime, dropping out of school, unemployment, poverty, and so on. So the two departments, if we don't do what we are expected to do to fight poverty, to make sure that people have life skills, to make sure that people have economic empowerment, in support of what the health department is doing. When we talk about a healthy human being, we talk about a holistic healthy human being. It cannot be about pills only. It's about psychology. It's about how you function. So our programs are very complementary, and also our partners have to know one another. That is why we have created this platform, so that they can network, so that we can get optimum benefits from the partnerships.
And when you sat together with the Department of Health as well as the private sector, what did you hope to get out of this? When you were planning it, what did you hope to get out of this? And would you say today at the end of this event that you have achieved your goal?
Well, the immediate benefits are the networking, knowing what the right hand is doing, the left hand knowing what the right hand is doing. But long term, what we want to achieve is written, formal agreements. We want money from the private sector. I can give you an example. For early childhood development, for instance, we provide a subsidy as government, as the Department of Social Development. Health will bring the nutrition and the health aspects. But in terms of infrastructure, we are inviting the private sector, please help us to build this nation. Invest in capital projects. It's a once-off. We will acknowledge your contribution, but you will know that it is a lifetime investment for a number of children. So we are looking for formal agreements with X number of indicators, performance indicators that are measurable, where we can say, today we were here, in a year's time, this is what we want to achieve. We already have a lot of people that have told us, that have presented during the gala dinner, to say that we are the biggest NPO that is supporting NPOs. If I can mention a few, I hope they will not be angry with me. The National Lotteries Commission said we are here. We have the money, come and we are prepared to partner and take your development program a step further.
All right, that was the HOD for the Department of Social Development in the province, Memamsi Motobi. We had not expected to see her here, but gladly she graced us with her presence. Palisa, as I mentioned earlier, there are quite a lot of exhibitors right here. I'm going to be inviting later on one of the exhibitors to talk to us about some of the new technologies that they're bringing on board, some of the new innovations that they have to offer to the Department of Health and Social Development. Palisa.
All right, once again our reporter live from Mahikeng, Kobokone Buperima, Olebogeng Khosilintswe.